We're going to talk today about schizophrenia. Today's video is specifically on this topic: what are positive symptoms? Positive symptoms can include hallucinations, delusions, confused thoughts, and a change in behavior or thoughts. Delusions, in particular, as defined in the following way. A delusion is a fixed false belief that is not consistent with a person's religious or cultural beliefs. The thing about delusions is that that belief is held with 100% absolute conviction. It may affect the way a person behaves and certainly can affect the way that they feel. Delusions can begin suddenly, really one day to the next, or they can build up very slowly over time, sort of insidiously. Some people can develop delusions that have a relationship to hallucinations that they feel, and we'll talk about that in just a moment. There are several different types of delusions, and understanding schizophrenia, really it helps to have a grasp of the types of delusions. A paranoid delusion or a delusion of persecution is probably the most familiar type of delusion to most people. In that type of delusion, a person would believe that others are out to get them, after them in some way. It could be bizarre, or it could be almost practical in a way. People might believe they are being poisoned, or they are being followed or watched or chased. They could believe that there are cameras surrounding them, cameras implanted in the walls. People are looking at them through the windows. Sometimes people would believe that there might be a plot out for them. They might believe that in a more bizarre way there are aliens or Martians following them. Or there are some beings that are trying to poison them or get at them, make them sick with radioactive materials. Another type of delusion is the delusion of grandeur, where a person might begin to believe that they are very famous or they are important in some other way. Perhaps they are a powerful world leader or political figure. They might even believe they are Jesus Christ, or they are a figure from history, or a biblical figure with special powers. They may begin to believe that they have powers that are magical, like they can fly, for example. There's a particular type of delusion called a delusion of reference, and in that situation, a person might begin to believe that a relatively neutral trigger in the environment, say a particular song comes on the radio or something on the television, has special messages or meaning for them specifically. Delusions of control has to do with the belief that your thoughts specifically are being controlled by an outside force, and that alien forces are somehow making you do things or think things that are beyond your individual control. Sometimes there's a feeling that your thoughts are being broadcast somehow out into the external world, and that your private thoughts are transmitted publicly, or at least being transmitted such that certain other people, certain other beings can read them or can detect them. This is obviously a very frightening experience for someone who is having it. Another positive symptom of schizophrenia is the hallucination. Hallucinations are not only found in people with schizophrenia. They are very common in other types of illnesses, but for purposes of this video, we are talking about schizophrenia. Hallucinations are sounds and other sensations that are experienced as real when they really exist only in the mind. They can include any of the senses, any of the five senses, but auditory hallucinations, hearing things, tends to be the most commonly found in the disease of schizophrenia. Most commonly, what people will hear are voices, sometimes mumbling, sometimes conversations about the individual who is experiencing the hallucination. It should be noted, by the way, that with auditory hallucinations, hearing voices, those voices can be it can feel like they're coming from a lot of different places, sometimes outside the window, sometimes the room next door, just beyond the wall, sometimes from the television or the radio, but generally not from inside the person's head. Sometimes it feels as if the voices are talking directly to the person. Sometimes they're giving instructions or commenting on the person's thoughts or behavior, almost like a running commentary. Sometimes they are actively discussing the hearer's thoughts as the thoughts are occurring. Sometimes the voices are the voices of people that you know. Sometimes they are completely unknown to the individual. Sometimes they are vulgar and abusive or frightening and scary. Sometimes they are friendly and almost welcome. More often than not, they are bothersome. Visual hallucinations do occur. They are relatively common, although less common than auditory hallucinations, and they tend to be experienced as frightening, more frightening and more disturbing when the person is alone. Another positive symptom of schizophrenia is disorganized thought, confused thought, which typically comes out as disorganized or confused speech. So people experiencing psychosis and schizophrenia is a psychotic disorder will have difficulty keeping track of their thoughts, keeping track of conversations. Some people find it very, very hard to concentrate, and they will drift from kind of one idea to another idea. They might have trouble reading a newspaper even, or a magazine, or even something simple as a television guide. Sometimes they will describe their thoughts as feeling hazy or foggy. They're being kind of a mist around their thoughts. And when this is happening to them, they'll get very frustrated and feel maybe frightened or especially disturbed. Speech, as I said, is often the way that loved ones will detect there's something wrong with the person's thinking. The speech may become jumbled and confused, making it difficult for other people to understand what's going on inside the person's head, and making it very difficult for them to communicate. Here are 4 signs, specific signs of disorganized speech, which indicate a breakdown in thought processes that you see in schizophrenia. One is loose associations, and that is the rapid shifting from topic to topic to topic with really no connection in between. So often the person will be kind of talking and talking and talking and talking and talking. It won't make a lot of sense to the listener. Another is neologisms, which is really made up words and made up phrases that mean only something to the speaker, not to the listener. And sometimes in the context of the speech, this stuff will be thrown in all over the place very rapidly and will be very, very confusing. Perseveration, which is the repetition of words and statements saying the same thing, which may be completely meaningless, or it may have meaning initially, but then saying the same thing over and over and over and over again without any particular reason. Clanging, which is the rhyming of words without particular meaning. So an example, which I did not make up, is I said the bread and read the shed and fed Ned at the head. People with schizophrenia can sometimes go on in this sort of clang association way for tremendous amounts of time. And finally, another positive symptom, the last positive symptom we'll talk about, is disorganized behavior. Their behavior can become extremely unpredictable and somewhat chaotic. They can begin to do things which are very bizarre. They can dress in multiple layers on a very hot, sunny day, for example. Standing in bizarre postures, moving in awkward and bizarre ways. They may have extremely inappropriate emotional responses. They may lose the capacity to inhibit behavior and lose impulse control. So that's it, really. What are the positive symptoms of schizophrenia? Remember, there are positive symptoms, there are negative symptoms. My next video, which I will post in a couple of days, will review the negative symptoms. The positive symptoms include hallucinations, delusions, disorganized thoughts, which manifest in the speech patterns. That's how people can tell that's going on. And then disorganized and bizarre behavior. So it's really those things that are predominantly the positive symptoms of schizophrenia. So that's it for today. Thank you for listening. Remember, if you're interested, then please subscribe and hit the notification bell so you don't miss anything. I really appreciate you listening, and I'll see you next time. Thank you.